I'm Katherine Frasca. I do a lot of education in HIV treatment and prevention and clinical work in that space. I love being an educator because I get to advocate for patients and I get to spread and magnify that advocacy. In the US, many of the populations affected by HIV are our marginalized folks who are already dealing with so many challenges in their regular life, so much stigma around their identity. And so I'm always amazed at my patients who are on HIV prevention. I see their transformation from before they started to after, and they are engaged and an advocate for HIV prevention in their community, and they are really what makes my day. I started out 15 years ago in HIV care. At that time, we had very few one-pill-a-day medication options. Now we've gone to so many different options, easier to tolerate medications, and also the empowerment in the community, the advocacy to push for better treatments, more access to testing to ultimately reduce the epidemic, eliminate HIV, and work together as a community. So when I was a medical student, I went to Malawi and I worked in a rural hospital. I still remember some of the women who, while I was there, didn't survive their hospital stay. And they were young women my age. And I remember thinking, that could be me. And if I had been born in this part of the world, I might not have made it to this age and this time. And even though HIV disproportionately affects certain populations, it doesn't have boundaries. Anyone can be impacted anywhere. In sub-Saharan Africa, women and girls bear the burden of HIV. We need to get them easier access to testing, treatment, and HIV prevention. And in so many of those places, it's important to have community and peer support and engagement, community health workers. So really, it helps everyone's health, but also the global economy to support these interventions on a grassroots level. I think it's our duty, and healthcare is a right, to help and work together to end this epidemic.